And we're back with Dr. John Young, the Young Foundational Health Center in Largo, Florida. Dr. Young, good to see you, my friend.
Good to see you.
I like your backdrop there. I'm going to tell you that last. I feel worldly when I see that. I feel like we're really about to explore some stuff here. It's motivating for me to see that.
Well, it is a worldwide problem.
Yeah, that's very true, actually. Everything is, it seems now. I like that. Listen, our last radio show, our interview, that inevitably, gets shared to all of our digital podcast platforms and all of our social media channels and LinkedIn newsletters and stuff. We actually have a new text line that this will also be shared out. Was really one of the most shared pieces of content that we've done. I've been doing this a little over 3 years. And I want to just mention that to you and to the audience who's consuming this now, because I really thought you brought not just great information, but a lot of things that people haven't had conversations about. So I thank you for that. And, we're getting a lot of messages. People say, well, when is Dr. Young coming? When's Dr. Young coming back? So I said, well, he's got a lot of patients. He's a busy man. He's running the health center, but we're going to have him on, monthly at least. And I'm excited about this. So youngfoundationalhealth.com. Again, it's Dr. John Young, Largo, Florida. We talked last time about the brain, and we talked about it being an electrical system. And I know that was something that I thought was really fascinating, and the audience did too. Let's talk a little bit about what are the things that kind of go into the electrical system. And I wanted to start with iron as kind of an ingredient.
So it is very interesting, but if you look at just in worldwide, iron deficiency is a big, big problem worldwide. And we're seeing more and more autism just worldwide is almost epidemic. And I think a lot of the problem, and doctors miss this, because in our training, we're taught, you look at that CBC, complete blood count, white cells, red blood cells. Then they have these MCVs, mean corpuscular volume, MCHC, all these that everyone gets lost in. And what we started looking at was this MCV, mean corpuscular volume, the size of the red blood cell. And it's very interesting, but they have ranges, 80 to 100. If that MCV is in that area, you're fine. Well, as we started looking at autistics and then a number of chronic fatigue, we saw that, that may not be true. Those ranges, I think, are too large. And so when we started really looking at that and saw that that MCV, the size of that cell is around 90, we then started to look at the iron levels. And why is this so important? Because if you have a small red blood cell, you can't hold on to much oxygen. With low oxygen, you have more inflammation, which is the last thing the autistic brain needs. The other thing is, none of your organs are oxygenated well. So it's just a huge stress on the body. And so, you can give people iron, but for a lot of my patients, the iron was very, very low. And if it's really low, it's hard to get iron levels back taking iron pills. It's very hard on the stomach. Some of my autistic kids were so low, we had to send them to the children's hospital to get iron IVs. It was that low. And it was interesting. When we got iron into them, the families are saying, Johnny is so much better. He's not as, stressed. The temper tantrums are less because the brain is not as irritated.
I was going to ask you, what is something a parent could look and go, I wonder if we're dealing with low iron levels.
Brain irritation, uncontrolled behavior, things like that. Or another one is this, that, do you notice that after we walk a couple blocks, he has to stop and rest because he can't exercise as well because he runs out of oxygen so quickly, and the body has to pump the red blood cells back to the oxygen and get more and then go out again. And so the bigger the cell, the more oxygen it can hold on to. But the other thing that I started to look at is, and you can ask your doctor, get an iron level, total iron level. The ranges are 50 to about 170 in some of these labs. You want it up around 85 or 90. The other thing is you want to look at the percent saturation. That tells you the protein content. And I had a kid come in, and the iron level was actually pretty good, but his percent saturation, how much protein was in the blood, was extremely low, way below their range. Because his hemoglobin, the red blood cell, heme is iron, globin is protein. If you don't have the protein available, the iron's just going to sit in the bloodstream and you never can use it.
All right, now, are we talking about the protein that I'm thinking of, like protein from meat? I mean, is that
Yes, okay. Yes, plain old protein.
Okay.
And listen, and I knew this was going to come out as we talked about this today, but it's going to, it is so hard for a lot of these autistic kids. The number of foods you can give them is so difficult.
Yep. It's, sometimes there's like 3 food groups, and unfortunately, one of them's like always pizza or macaroni and cheese. And so you're left, with 2 other options.
And so what I said, so how much protein does a person need? I take their weight, divide by 2.2. So, if they're 50 pounds, or let's say 50 pounds, they need about 20 grams of protein a day. And so, and you can look up, 1 egg is 8 grams of protein. 4 ounces of meat, fish, chicken, beef, whatever, is 15 grams of protein. So, in other words, saying to them, over that day, you've got to get 20 grams of protein in them. You don't have to do it all at once. But if he has, and I know that some people are going to go crazy here, but even some chicken nuggets.
I knew if you didn't say it, I was going to. Don't worry.
Or my daughter likes ham sandwiches. I put on, 2 pieces of ham is about 5 grams of protein. I put on about 6 pieces of ham. 30 grams is the most you can absorb at any one time. But trying to get the protein in them. We have a protein shake we use, and I want to make sure, and I've done this with some of the parents, I've said, listen, we need protein. And if necessary, you can add some things like, he likes chocolate syrup, which kind of drives me crazy because of hydrogenated oils. But I've told them, listen, he needs protein. If you want to put a little bit of chocolate syrup in there, just to get him to take it, do it. But, come up with some flavorings that you could make that so that he can sip on that throughout the day. But to absorb the iron, you have to have the protein. And iron is extremely important in the autistic brain because it's one of the ways to reduce the inflammation.
So I like this because it's one kind of needs the other, right? Like we've got to have the protein in order to accentuate or increase the iron for the brain, right?
Right. And it's very interesting in studies out there. With more iron, you carry more oxygen on the red blood cell. You also can remake that myelin sheath, the insulation along the nerve that this synuclein protein has messed up, as we talked earlier. With plenty of iron, you can make neurotransmitters, serotonin, dopamine, the feel-good anti-anxiety neurotransmitter, epinephrine, norepinephrine. With more iron, they've done some great studies. You increase the cognition, intelligence. You need iron for intelligence. Attention span seems to be related to iron deficiency, sensory perception. Iron is all involved in all of that. And so, it's just working ways of getting that iron in. But to use the iron, you also need the protein. And
And
so,
you had mentioned a shake that you use. So you obviously are open towards supplements. I mean, obviously, if it's the only way you can do it, that's better than not doing it.
right. And then I have some people that are vegans, and the family is, and so they could use a pea protein. Did that, but just getting the protein in there. I like vegetables, but vegetables do turn into carbohydrates, which you need, but a lot of carbs, there is inflammation there.
Okay, that's great info. I would not have imagined that the iron and the protein had kind of a symbiotic relationship. And as you mentioned, the diet with these kids. I mean, we laughed when you said chicken nuggets, but my God, sometimes that's the only protein some of these kids will get. And it's interesting that chicken nuggets is kind of number one on the list when it comes to I mean, my son, I remember, now they have chicken nuggets that are shaped into dinosaurs. Okay. And that's the only way we could get him because they have the Tyrannosaurus Rex dinosaur and the Stegosaurus. And did I love it? Absolutely not. But I came up with a saying a couple of years ago on this, and I said, sometimes you got to do the wrong thing for the right reason. And I know overall, a chicken nugget, there's some processed stuff going on there. There's some breading, but there is protein. And I just thought it's better than nothing, right?
Right. Or some of the, I don't want to be sexist here, but some of the adventurous moms out there can maybe take a cooked chicken and turn it into whatever.
Yeah.
Without some of the, hydrogenated oils and things like that. But it's a protein. If you're good, it's an electrical problem, which also has to do with neurotransmitters and things like that. So iron is just very, very important here.
That's great info. Again, I we spent years with our talking to people and taking Cal here, there, a neurologist, and this is just stuff that you don't hear about, and we'll have more conversations down the road probably about why, and there's got to be some reason. But I want to talk about one of my favorite things coming up, vitamin D. I love vitamin D. I've researched it a lot. I think it's something that I don't know that we ever get enough of it. But let's talk about as it relates to autistics and autistic kids.
All right. Now, before we go there, let me just give a disclaimer.
Okay.
Any of you that get the LabCorp labs, if you get a vitamin D level, they always reference Michael Hollick. He's he is the one that put the ranges together on the labs. He's considered the father of vitamin D, you might say. Worldwide expert. He and I have become very good friends. But he is the one that I've used for my information. On the board of the American Academy of Endocrinologists. And one of the things that he told me years ago is this. If you go by those standards of vitamin D levels between 30 and 100, that is not all the truth. In other words, John, you go higher with vitamin D, you're going to be a very happy boy. And my daughter has Down syndrome, and their immune system is terrible, as are a lot of most all autistic, their immune system is terrible. And he said, if you increase the vitamin D, you're going to be a happy boy. And so the hospital said, your daughter has Downs, no immune system. She'll just be on antibiotics every month for the rest of until she's 12 years of age. And so get used to it. Let's see, wait, she's 13. Oh, wait, she's never been on antibiotics. Now her vitamin D level is 233. Because vitamin D has a huge say on that immune system. And Hollick has done the studies showing that when vitamin D levels up around 250 to 300, you see really no Crohn's disease, no MS, multiple sclerosis, very little rheumatoid arthritis. It is just really amazing. And so, talk to your doctor. But the things that you have to know before just willy-nilly doing this is you have to know what the calcium levels are. Have to know what the urine calcium levels are. And if those things are normal, you can go very, very high. But I don't want everybody to just go out and give their kid a ton of vitamin D. But I do get these levels with my patients because when you increase the vitamin D, you make the immune system much stronger. And these kids all have poor immune systems. Those studies have been done. Number two, you also decrease the neuroinflammation. And the other thing is, in that Krebs cycle, in that first step in making energy, you need a ton of vitamin D to make 28, 29 ATPs of energy. So vitamin D is just extremely important, and it's really not a vitamin, it's a hormone. It is a hormone. I think the best way to take it is liquid. Liquid haloctone is much better absorbed than pills. And so I found that very true with my own daughter. Vitamin D increases neural growth factor. It helps with differentiation of the neurons in the brain. It helps to just make dopamine, serotonin, epinephrine, norepinephrine. It helps in with the myelin sheath also. So, listen, there's a million things you can do. I'm trying to keep this simple for everyone. Vitamin D and iron are two really inexpensive ways that patients can make a huge difference in their child with autism.
And on top of that, is it still beneficial? I mean, so let's say we're supplementing it. You said you prefer a liquid. Would it still be beneficial to go and get that extra sunshine and eat the foods with vitamin D? Does that still help?
All right. So, yes, the best way is being in the sun. But here's, a lot of kids nowadays are on their iPads or their phones or whatever all day long. And the best times to get vitamin D are between 10 and 2. If you live north of Atlanta, that parallel, you make no vitamin D from November 1st to April 1st. So you can be outside naked and you will not make any vitamin D because of the angle of the sun. So the other thing is, if you're going to be outside, like here in Florida, for 20 minutes between 10 and 2, you're going to be fine. Now, if you have sunblock on, you cannot make vitamin D. So there's walking that tightrope where, listen, I want him to absorb vitamin D, but if he's going to be out in the sun for 1 hour, that kid's going to burn. You have to be really aware that, all right, he's been from 12 to 12:20. All right, Billy, come on in. Let's get some sunblock on you, and you can go outside and play.
That's that's good advice. I just I'm a believer in vitamin D. I'm with you and the other doctor that you referenced. I just if you overall are somebody that thinks that you're eating the right foods to get vitamin D, I'm not sure that's the normal typical diet that's possible. And I like the aspects about how it helps the autistic brain as well.
Well, now the other thing is this. All right, first of all, I'm going to give this just a little side note. But with my kids and my friends and my patients and all of that, a little trick of the trade I learned from Professor Hollick. You come home from work, a little achy, sore throat. Honey, you going to come down for dinner? No, I just want to lay down. I have them do 40,000 units. This is my patients, 40,000 units of vitamin D at bedtime. 90% of my patients, when I see them later, say, John, I took that the next morning, never even realized I was sick because it jump starts the immune system. And with Catherine, I would give her 20,000 younger right before bedtime. And a lot of times that runny nose and all of that is gone. So it's a quick way of jump starting the immune system. It's not going to mess things up. But there's some very interesting studies with low vitamin D in women and in that maternal age, childbearing age, that there is a strong correlation between low vitamin D in the mother and autism in the child.
Hmm.
Very strong correlation.
That is interesting.
And so, those of you thinking to have kids, get your vitamin D level checked. It needs to be at least over 60, at least over 60 on the U.S. ranges. But and with the kids, yes, I like them over at least 60. Just as an adult, you need it over 60 if you want any type of cancer protection. The low range is 30, and that's for rickets. The high range was 100, but that study has been shown that it does not cause kidney stones. That's where that came from. And I talked to Professor Hollick on that. So, but vitamin D in the kid, I would really work to try to get it up at least over 60.
Okay, that's good info. And I also want to talk about, we always, I guess we're kind of trained when we hear oils that's a bad thing. Oils are there's all kind of oils and they're not good for our cardiovascular system and our blood and everything like that. But what are the good oils that either we need or that don't necessarily hurt us, or maybe as it relates to the autistic brain could be a positive?
Okay, so think of the omega-3, 6, and 9s. The 3s are like the fish oils, flax oils, things like that. The big omega-6 is MCT, is coconut oil, which people are taking for Alzheimer's because of the book that came out. And then 9s are a little more pro-inflammatory. We really need all three of them. All three of them. I find in America, we're good at getting a lot of 6 and 9s. Very poor at the 3s. The other thing to remember is this, and maybe the textbooks of medicine are wrong for the last 100 years, I doubt it. But really, to absorb an oil, you need to emulsify it in a protein. When you eat fish, is the oil on the right side of the fish and the meat on the left? No, it's all emulsified in the protein. Nuts, is the top part of the nut oil and the bottom part the meat? No, it's emulsified. So the way the body's designed, it's easier to absorb these oils when they're emulsified in a protein. Once again, protein, here we come.
Mm-hmm.
So I think the best example I can think of is I had a lady with no vitamin A in her body, and she was blind. And they gave her vitamin A, and it didn't do anything for her. I took the vitamin A and I put it in with a protein, made a protein shake out of it. Her vision all came back. She got tired of doing that, just mixed it with cranberry juice, never returned. Once you put it in with the protein, can make an emulsion, the vision comes back.
Yeah, because that seems to me like, because I'm thinking of like the gel caps, it's a lot of people think of those things, but that would be easy to mix into some type of protein. I mean, that's not a hard thing to really imagine being done.
Right. So that's why I like the liquid vitamin D. Now, with vitamin D, I don't have to make the emulsion so much, but the other vitamins I do. But in getting, what they have found is when you can get the omega-3 vitamins or oils into these patients, they do very well. Now, taking a capsule, I don't like the omega-3 capsules because to keep that capsule from going rancid, they have to put a preservative in there. So you've killed the electronic activity of the oil. So that's why I like, we use Barleans, there's Carlsons or whatever. They're all the liquid's in a nitrogen container. I mean, packaged under nitrogen. So when you open it, you have to keep it in the refrigerator. What I try to get some of my patients to do is start maybe with a teaspoon or 1/8 of a teaspoon of oil in, let's say they can make a little protein shake for their child, just to get the omega-3, the anti-inflammatories in. And there's a ton of great research out there. about the anti-inflammatory oils in the inflamed brain, in the autistic brain.
Yeah, and that's something from a diet perspective. I mean, I was just thinking about my son Cal. I mean, I don't know. I don't even know where he would be getting these omegas from. I mean, it's just hard to imagine. That's
So
a tough thing in their diet.
a lot of people use fish oil for omega-3s. I can't do it. It's too fishy for me.
Yeah.
So I like the flaxseed oil, and you can hide that in anything. You see these people, they all are selling oil drinks. Here's your omega-3, just drink a tablespoon of it. It's very interesting. I was a guest of honor at a large nutraceutical that makes these omega-3 oils. And they invited me as the guest of honor. And I said, man, this oil you've made is great. It tastes great. John, we think we've really cornered the market. I said, let me just ask you a question. Isn't it true to absorb an oil, you have to emulsify it in a protein? Well, yes, John, that's true. But we're hoping because we micronize the oil, it'll be absorbed. Oh, so you're hoping, but you have no data to support it. Yes. So it goes back to basic physiology.
Yeah.
Which is oils and protein. But, getting these things down, kids, I know it's hard. And that's where I think these moms, parents working together, getting protein in. If you're going to try with a protein shake, make sure it's a complete protein, not a isolate, and that there's no powdered oils in it. And go from there. But in the American diet is not that good.
Mm-mm.
It's a lot of hydrogenated oils.
Yeah, and it's with the people I've talked to and the research that I've done, not as extensive as yours, obviously. It seems as though it's also getting worse. I mean, the more we go, it seems like these big companies are becoming used to these fillers and these oils and everything, and it's a profit thing, and I get that. But what I love about this so much is, again, you talking about let's getting back to the basics, and why protein is so important and plays such a. I mean, it's an ecosystem, so you need these other things to kind of play together. They all got to kind of play together to get the result that you want. That's really interesting. I mean, you talk about iron and vitamin D and the oils and protein. I mean, all kind of having this relationship, and again, to kind of fuel. Well, I don't know if that's a good word. It's an electrical system, but to spark it and maintain the energy and everything like that. That's just stuff you don't hear a lot about. So I love these conversations. Let's get to a couple of questions real quick. We could be here all night, but I grabbed three that we had some really good questions. This is Lisa in Clearwater, and she said, why do regressions just seem to come out of nowhere? She said, my son will have great behavior. He'll be just fine. And then all of a sudden it's meltdown after meltdown after meltdown. And then all of a sudden they'll stop again.
All right.
And I know that's a very general and without knowing the child and the situation, but obviously a lot of the young autistic kids, they will go through these meltdown phases. And so I think what she's alluding to is, what could I do? Is there anything out there I could try?
Well, I've seen some of this with growth spurts in kids and things like that. The other thing is, I would think inflammation, and I would go look at, is his diet changed? Is he getting stuff at neighbors' houses eating that he shouldn't be eating? But think of inflammation. It could also be a sign of some type of viral syndrome he's fighting or whatever. But the first thing I think is inflammation and trying to get some good omega oils in them. If they eat fish, give them some fish or whatever. But think inflammation. Might go up on the vitamin D some. There's a myriad of things. But I think vitamin D, making sure, especially if they're growing, they're going to need more iron. You drop the iron, and you're going to have more inflammation. And remember, when these kids are growing, they're going through iron like it's candy.
That's a good point. Yeah. And we obviously don't know the age of the son there, but again, something I didn't think about, because as different as the autistics are from the brain perspective, I mean, it's, they have growth spurts like any other kid.
Right.
These things happen. And so those effects that would, happen to a normal body, a normal growing human, are still happening to them. So that's
So iron and vitamin D are important in making dopamine, which is the feel good anti-anxiety neurotransmitter.
Renee and Largo, she said, this was a message on Instagram. Does Dr. Young know of any safe sleep therapies? My son is 9 and was diagnosed with autism when he was 5.
There's just a lot of controversy about some of this, especially with kids. I don't have any problem with very low dose melatonin, but she would have to run that by her, pediatrician. Once again, might look at ways to increase dopamine because dopamine has a lot to say with sleep. And one of the things that I've given my patients is lithium, not the drug. Not the drug. It's the mineral. Tesla cars do not run on a drug. They run on the mineral batteries, lithium batteries, third element on the periodic table. But I start my kids on a very low dose of lithium, the mineral. Get it at any health food store. Lithium orotate, and I gradually go up, titrate up. And you can talk to your pediatrician about that. And for a number of kids, that really helps. That really helps because you need dopamine for sleep.
Yeah, and
lithium and protein to make dopamine.
And wouldn't like the other things that we've been talking about, those things are just helping the electrical system run smoother. So if those things are being done, we talked about the vitamin D and the iron and protein and everything like that, naturally wouldn't having some of those things addressed and taken care of a byproduct that could be a better sleep cycle, right? Because everything's just kind of working the way it's supposed to work.
Now, there are some interesting studies looking at 4-aminopyridine, which we talked about last time, with sleep and sleep apnea and all that. But I think if you're looking at just natural stuff, what we just mentioned.
Okay. And then finally, Michelle's in St. Pete. Actually, I got several questions like this. And so she said, are patients able to be seen by Dr. Young, but also keep their same neurologist? For some reason, and I don't know if it's a controversy or what, but like I said, I've gotten several messages like this. There's a concern by people that if they have a neurologist, but then they go see another doctor who may be outside of the neurologist practice. I don't exactly know how it goes, but there's a concern of, are we able to be seen by somebody like Dr. Young and also keep our neurologist, or is there some wall there in the middle? And I certainly don't have the answer to that question.
So I don't know of any wall there. Listen, people come to me for me to, in other words, if you're happy where you are, people are not going to come to me. If you say, listen, I've been to the neurologist, the kid is no better, we're going nowhere fast, then I will, do a workup and come up with suggestions. It's never my way or the highway. Now, some neurologists, in fact, there's one neurologist was really impressed that I ordered what I did because he knew that, gee, I should have ordered that also. But I tell them, you can share whatever I'm suggesting with your neurologist, or you can keep it quiet. I know there's a lot of people upstate New York who will not tell their neurologist anything about what they're doing down here because there's such a hatred towards anything outside the AMA approved guidelines. So what I am doing really does not seem to would counteract anything that the neurologists that I have seen do with my autistic patients. But that's up to that patient if they want to share it or not. They want to run it by him. I have no problem, none whatsoever. Um, I've talked to some of these neurologists, but and listen, it's only because I've spent so much time at 3 a.m. to 4 a.m. reading this stuff that I'm at a different level. I'm not smarter, but I'm at a different level with this, with all the biochemistry of this, and they're not going to be there, which is okay. But it's just that I've spent so much time looking at this. But I will see anybody, and it's up to the patient what they want to share with the neurologist.
Yeah, it's interesting. Last week, my wife said, "Oh, I've got to take Cal for his, annual neurologist appointment," and I said, "Why?" I mean, and it's not that I don't like neurologists. I love neurologists. It's great. I mean, that's you have to go through the whole process with the diagnosis and everything like that, among many other professionals. But to just have an annual with nothing is, the track is the track. We're doing what we're doing. It just is. I want to get exploratory in some of these other things. I want to meet the Dr. Youngs of the world, and I want to see. I want the guys that are working at 3 a.m. You know what I mean? That's what I want. I want to, and I know you'd probably like a little more sleep, but those are the personalities and kind of the people that I'm interested in learning from, and I can prove that provides value for not just our audience, but everybody else out there who's talking about these things. Because when I get together with these people, that's what they talk about. They talk about the people who are doing the work, the research, the thought, and the conversations that you're doing. But I did get a lot of questions like that. So I thought to myself, well, I should ask, because there are people who are probably really interested in talking with you, sitting down with you, introducing you to their child, coming to your health center, and maybe I just thought, well, maybe they're asking, maybe there's something there that, they were concerned, but it's nice to hear that, that you do the work anyway.
No, there's no problem with that patient, the family seeing a neurologist or whatever. I have no problem with that.
Great. Well, that's Dr. John Young. It's youngfoundationalhealth.com. I wish we could talk for hours and hours, because I feel like you've got so many of the answers to my questions inside your brain, and I want them all, but little by little, we'll get it done. But appreciate your time as always, Dr. Young. Again, youngfoundationalhealth.com. Look forward to not only broadcasting this across our radio stations, all of our podcasting platforms, and our social media channels as well. But looking forward to talking with you next time, sir.
Well, enjoyed it, and looking forward to our next visit.
Sounds great.